Vertigo, a feeling of dizziness, a swimming in the head. Figuratively, a state in which all things seem to be engulfed in a whirlpool of terror, as created by Alfred Hitchcock in the story that gives new meaning to the word suspense.
So, hi. Uh, so today we will be discussing about Meniere's disease, and this is the first video lecture on the subject ear, nose and throat, that is ENT. So ideally the subject should start with the basic anatomy and then the physiology and then slowly moving on to the disorders. But fuck the ideal order. We'll start with the Meniere's disease and then we will understand the anatomy and physiology to understand the Meniere's disease. And whatever. So I will be talking little bit about basic anatomy, then I'll be talking about little basic physiology, okay, then how it's happening, like the hearing thing, how it happens. Then we will, after understanding little bit about these two things, then we will be good in understanding what is wrong happening here in Meniere's disease. Okay, so I will just show you the notes. So this is the entire notes, and this is I think we will be discussing until the variants. The clinical examinations, investigations and treatments will be dealt later, okay, because this needs much, like if I see, the thing is I have to make the video shorter, as short as possible. Okay, so I'll quickly try to finish all these things, and this will be taken up in next video where I will be discussing each of this in detail. Alright, so let's begin. So if we start with the basic anatomy, to understand the Meniere disease, so Meniere's disease is mainly a inner ear problem. Okay, inner ear means, so we have three, like talking about basic anatomy, here in the picture it is not given, but outside obviously we have the ear pinna and the auricle. Then if you enter, there is this auditory canal, okay, and then we have the tympanic membrane which is connected with, so after until here is the external ear, this is the middle ear, and this is the internal ear. So middle ear has all these three ossicles, okay, malleus, incus and stapes, and inside we have the internal ear, middle ear, internal ear, or inner ear, sorry, okay. So if I just zoom in, you can also see what is inside this inner ear. So inside this you can see, okay, this inner ear is made up of what? It is made up of the bony labyrinth. Labyrinth means what? This kind of spiral coiled thing is called as labyrinth. So outside it is made up of bone structure, okay, hard one. But inside you can see this is the membrane. This blue thing is there, that is the membrane. So the blue thing, coiled up thing, is called as the membranous labyrinth, and the outside which is covering that is the bony labyrinth. Now the thing is, inside this bony labyrinth or the membranous labyrinth, it is not empty or there is no air inside, there is fluid. Okay, so the fluid that is present inside the membranous labyrinth is called as the endolymph. Endo means inside, and perilymph is outside of this membrane. Okay, peri means what? Adjacent or side. So इसके आजू बाजू, इसके जो this is the membranous labyrinth. Outside this membranous labyrinth, but inside the bony labyrinth we have the perilymph. Okay, so if you are not able to understand, again what we have here, the semicircular canals. This is the anterior semicircular canal, this is the lateral semicircular canal, and this is the posterior semicircular canal. Then we have the utricle and the saccule. Okay, and here I want to focus on a structure, that is the vestibular aqueduct. You can see here, right, this one, vestibular aqueduct. So why is it important? Because see, the fluid that is present inside the membranous labyrinth, so it has to come from somewhere, no? So the fluid comes from something called as stria vascularis. So it is from the inside only it is forming that stria vascularis. It is nothing but a bunch of capillaries and certain cells which is producing that endolymph. So the endolymph is produced in this, and it is circulated in all this membranous labyrinth. But at certain point, if something is producing here, something has to be absorbed also, no? From here the drainage should happen. So that drainage happens from here. And why am I discussing this? That you will understand eventually as we discuss ahead. Okay, So if you did not understand this bony labyrinth and membranous labyrinth, like even when I was small and when I studied, I used to get confused, okay, what's happening here. So you can understand by this pen. Okay, so what is bony labyrinth and what is membranous labyrinth? Bony labyrinth is when you see this outer part of the pen, okay, the hard one, that is the bony labyrinth. Inside the refill is there, right? So inside the refill we have the ink. So that inside का जो refill है, that is the membranous labyrinth. Okay, something like that. So outer one is bony labyrinth. Inside that outer there is membranous. That is the membranous labyrinth. Okay. So we understood little bit of anatomy. Okay, that will be necessary to understand the disease. So this is just the, like, if you just open up this outer bony thing, you just see like this, something like this inside. Okay, so here again we have all this. What is this? These are the semicircular canal. Here this is nothing but the ampulla, the swollen part. Okay, there is some certain structures inside this, like there is cupula. Okay, and inside the utricle and saccule there is something called as macula. Okay, so that this part of the, so this entire thing, what is this entire thing? This is the organ, right? This is one kind of organ. This is called as the cochlear system. This is called as the vestibular system. So both of them makes what? This system helps us in hearing. This part helps us in the hearing. Okay, whatever you are listening to me now, so you are able to hear because of this cochlea. But maybe you are sitting or maybe you are standing. Okay, whatever. So that position sense, okay, the positional variation and sense, that is taken from this part of the system. Okay, and then brain interprets all of this. Okay. And it is not just this, there is also involvement of the this thing, eye involvement. Okay, eye muscles and all, vestibular, ocular reflex. We're not going in detail about that, so we'll stick to our point so that the video does not go long unnecessarily. So we understood basic anatomy. Let's talk about basic physiology, how the hearing and all is happening. So as I have shown you in this part, okay, so if I take a cross section, no, if I cut this, then you can see here. So let's suppose I cut here. Okay, let me just take this one. Where is ink? Okay, so let's suppose if I cut it something like this, then this is one part, right? This one is one part and this one is one part. So it will look something like this. So if I take the cross section, then it is something like this. Okay, so this side and this side we have the perilymph, and inside we have the endolymph. Okay, I can go like this also. Okay, better. So here we have that sense organ, that is nothing but the organ of corti. All right, and this base, okay, this is called as the basilar membrane, and this part is called as the resinous membrane. So here we have the perilymph, here also we have the perilymph, because the outside is covered by the perilymph. Here is also perilymph, here is also perilymph. Inside what do we have? Inside we have the endolymph. Got it? So let's discuss about that thing now. So here if you see this diagram, that is the same diagram I made that side. Okay, this side. So here we have the basilar membrane, here we have the resinous membrane. Now so this part, this is the endolymph. So in this, between this resinous membrane and basilar membrane, we have the endolymph. Outside what do we have? The perilymph. Okay, so now what is happening here? This fluid is not just water or not Pepsi, Cola, nothing. Okay, this is a special kind of fluid which is secreted. So this fluid is not coming from like thin air, right? From somewhere it has to come. So it comes from this this epithelium kind of. Okay, so this is called as the stria vascularis. See, it is written here. So this stria vascularis, they pump out the potassium, huge amount of potassium in the endolymph. So in this endolymph we have high amount of high concentration of potassium compared to this thing and this thing. What is this? The scala vestibuli and the scala tympani. So outside here we have this sodium concentration more. Now I want you to focus on this part. the 80 millivolt. This is the positive 80 millivolt. Why is this important now? This is important because now, as you can see here, what is this? This is the basement membrane. Now what is this? This is the organ of corti. There is something called as tectorial membrane, then there are hair cells. So this is called as the inner hair cell, this is called as the outer hair cell. So in the inner hair cell, this is single row. Okay, you can just see one, right? So these are the single row cells. Here we have three triple rows of cells, hair cells. Now this hair cell, they have, if I talk about one hair cell, can I just zoom in a little bit more? Now look here. So these are the hair cells. This one is called, these are called as the stereocilia. Okay, this is the longest one. Now why am I telling you to focus on this thing, the positive 80 millivolts? Because inside the hair cells there is negative 45 millivolts of potential. Okay, outside is 80 plus 80 millivolts potential. So if I take the difference, what is the difference? Difference is around 125 millivolts of potential difference exists between the this endolymph and the hair cells. And this is important because this is a high potential gradient, right? So as soon as any kind of wave comes from the ear and it travels into the organ of corti, so there is movement of these hair cells because of this tectorial membrane. Okay, there is movement of the hair cells, and because of that, this, the longest one, this, like all the hair cells, it goes like this. You can see the direction. So as it goes like this, there is something called as tip links. Okay, so this tip links kind of pulls this mechanically gated voltage, mechanically gated channels. Okay, voltage gated channels. So as soon as it opens up, because of this high potential difference, the potassium wants to run inside. Why? Because see, inside is minus 45, outside is plus 80, high concentration. So this potassium, it, as soon as it opens, it rushes inside, and when it goes inside, there is membrane depolarization, and because of this membrane depolarization, there is incoming of calcium, and this calcium pushes this vesicle, this granules, okay, and this glutamic vesicles, and this goes and gives the signal to the brain. So you're getting my point. Why is this potential important? Because this 80 millivolt and this 45, they are making huge potential difference. Like this is one of the highest in the body. Okay, why? Because see, hearing and balance, this is something that it should be, instantaneously everything should happen. Like there should not be any delay. Someone is talking, or somebody is pushing me, or I am falling, or I am balancing myself, sitting, standing position. So every time something or other motion is happening. Okay, so that is why our system is always like ready for taking the signals. That is why there is high potential difference. You're getting my point? So that is why okay, this happens, and then there is signal to the brain, and that signal happens how? Through this is the pathway. So from the vestibulocochlear nerve, that is the 8th cranial nerve, okay, it goes to the cochlear nuclei, and then there is this trapezoid body and all this. Okay, you can just pause and go through this. So we understood about some part of the basic anatomy, some part from the physiology. Okay, this is the same thing I have written here, so you can just go through this later. Now let's understand about the Meniere's disease, that is the today's topic. So what is wrong here? Actually, what is actually wrong here? Why it is highlighted and why it is not? Okay, whatever. So as I told you something here, what key? So this is my cochlea. Okay, inside this cochlea there is something called as stria vascularis. This stria vascularis is doing what? This is producing this endolymph, which is rich in the potassium, okay, which is maintaining electrodynamics of this hearing mechanism. Okay, that is the physiological part. Now as I told you, this stria vascularis is producing the endolymph. So if endolymph is being produced constantly, there should be some amount of drainage also, okay, along with that. Only then there will be balance, good balance. Okay, Now the drainage happens where? From this side. But in Meniere's disease, this is the problem. What is the problem? Mainly they tell that the drainage is the issue. Okay, there are like in the book it says ki it can be because of the higher rate of production. Okay, but most commonly accepted is the drainage problem. Okay, so if the drainage is not proper, there is fluid buildup where? Inside the membranous labyrinth. Membranous labyrinth means inside the this between the basement membrane and the resinous membrane, that is the endolymph. So if there is high amount of endolymph, what will happen? This will increase the pressure. So because of this excess pressure and excess fluid inside the membranous labyrinth, what will happen? This causes rupture. Rupture where? In the resinous membrane, which is the bulging here, right? So it can cause micro rupture here or maybe here, whatever. Somewhere it can cause micro rupture. Now you only tell me what will happen if there is micro ruptures or if there is bursting of this membrane. So whatever fluid is here and whatever fluid is here, it will mix. Okay, so what was here? Here was high amount of potassium. Here what was there? Sodium. So if there is mixing of all these electrochemical ions, okay, then what will happen? So obviously mixing of compartments of fluids, this will cause disbalance or dysregulated electrochemical gradient here, right? So didn't I tell you ki we need minimum of 80 millivolt positive, okay, positive 80 millivolts to depolarize the sensory organs here. Okay, so if this is disbalanced, then the sensory organs will not be depolarized properly, and this will lead to what? This will lead to something called a sensory neural hearing loss. Okay, so we got the first thing here. What did we get? We got the sensory neuron hearing loss. Did we understood? So here in the Meniere's disease pathogenesis, we understood the sensory neural hearing loss, and because of this also the intermix of this different fluids compartments, hearing loss is to there, and because of this rupture there is abnormal stimulations of these cells also sometimes. Okay, and because of this it can cause something called as tinnitus. Tinnitus, that is the ringing sensation, even though there is no bell around you. Okay, but still you can hear some ringing sensation, that thing. So we understood this point. Now as I am telling ki somewhere here if there is rupture of those membranes, then problem is somewhere here. But then the patient, he tells about vertigo. Vertigo means what? Vertigo means, if you have seen the intro, you might have understood. But vertigo, it means, let's suppose you are standing and all the world around you is rotating or something is happening. So that is vertigo. Okay, although it is the environment is static, you are also static, but it looks like the environment is rotating and going round and round around you. All right. So if I say, if the problem is somewhere here, because somewhere here was the rupture of membrane, then how it causes vertigo? Now that's why we need to understand that this is not just the cochlear defect, it is the labyrinth fluid disorder. Labyrinth means what? The membranous labyrinth. So entire membranous labyrinth disorder it is. It is not just cochlear, although later I will say that there are different variants, like there is cochlear variant, there is vestibular variant, where isolated symptoms occur. But typical case in typical cases there is vertigo also, there is sensory neural hearing loss and tinnitus. Alright, so if there is any problem, okay, so we understood this labyrinth fluid disorder. So something happened here will affect here too, because this is an entire labyrinth disorder. Okay, so here saccule and utricle both will be affected. What is there inside the saccule? The macula. What is there inside the utricle? The macula. What is there in the ampulla of the semicircular canal? The cupula. Okay, that we will understand in vertigo, that I will tell you. So we understood that there is some rupture here, that is mixing, that because of that there is mixing of the compartment fluids, that is we are losing our potential here. Okay, so that is causing the inappropriate depolarization or less polarization, which is causing my sensory neural hearing loss and tinnitus. Vertigo, why is vertigo happening? Let's understand here. So how vertigo happens? Now to understand vertigo, we need to understand certain structures here. For again the basic anatomy. So this was what? This was the hearing part. The cochlea is for the hearing. This part is for the balancing. Now how that balancing happens? We know there are these semicircular canals, okay, the anterior, posterior and the lateral one. So in this semicircular canals, and along with that we have something called as utricle, and there is something called as saccule. So this 1, 2, 3 things are here. So inside the semicircular canal we have something called as crista, or inside that we have the cupula and hair bundle. So just remember this crista. And inside the utricle and saccule we have something called as macula. Okay, so in the macula you can again see there are hair cells. And all this is again inside. It is present inside where? Inside the membranous labyrinth, which is filled with the endolymph. So all this is covered with the endolymph. As how that endolymph moves, okay, according to the waves generated, and according to my head movement, okay, waves generated in the sense it is sound, and movement because when we are moving, okay. So this you can see there is something here. This is called as otoconia. This otoconia is nothing but these are the calcium deposits, okay. So this makes it heavier. What heavier? This jelly kind of thing. What is this jelly? This is nothing but the otolith membrane. So this this has only one job to do, that is to increase the gravity, or the what do you say, to increase the weight. So whenever this person or me or you, whoever moves, like bending forwards, bending sideways, so this moves accordingly because of the weight and gravity. Okay, so you just see here. So what did I say? We have the we have the utricle and the saccule. Inside the utricle and saccule we have the macula. So this is the image of the macula, and inside the ampulla we have the crista. So you come here, if I tell you about, so this is the utricle, the U shape, uterus kind of shape. So this is the utricle and this is the saccule. So inside the utricle, this is present something like this, okay, like in the middle, and these are the nerves going. And inside the saccule, the macula is present vertical, like it is attached to the side wall. Laterally it is attached, but it is attached like top bottom. So I hope you are understanding by the diagram. It is present like this only, but it is vertically present because it is attached to the side and it is attached to the base, okay. So when you are standing and when you are in supine position, so in standing position you just see this, you will understand. So this will be like this only, but when you stand, because this is vertical, so this will come like this, this will come something like this because of the gravity here, as you can see. So in standing position, utricle, the macula in the utricle is in this position, but the position of saccule, like not the position, this thing, see, it is falling because of the gravity, So here actually I did a mistake here. These long hair cells are there. No, this long hair cell should come this side, and this side is the shorter one. This should come like this, So whenever there is gravity like this, so this will tend to fall like this. Now this hair cells, when all these small hair cells that they go something like this, like towards the long hair cells, they get stimulated, and when these get stimulated, they send signals. But at this point they are not sending any signal. So this is how brain interprets, okay, this person is standing from the saccule, and so from here the brain is getting positive signal, from here the brain is getting negative signal. Similarly, when you are in supine position, automatically you will understand ki now this part, the utricle ka macule, this goes in vertical position. So brain will get positive signals from this part and negative signals from the saccule part, and that's how brain will understand ki you are in the supine position, okay, but like you are not in the standing position. That's how brain interprets, and that's how these people send signal to the brain. Which people? The macula of what? Macula of utricle and saccule. So we talked about this one and this one. So utricle is done, saccule is done. Now let's talk about the semicircular canal and the crista. So you come this side. Now as you can see, this person is standing and this person is rotating like Shaktiman, okay. So these are my semicircular canals, and here we have some bulging part. No, this is called as the ampulla. Ampulla means anything bulged. So inside the ampulla, what do I have? I have the crista. So this is nothing but the crista. It is like a jelly kind of. Again, this is also a kind of jelly, but the difference is here you have the otolith, the otoconia, the calcium deposits, which makes it heavier. But here we do not have that. There is no calcium deposits here. Okay, it is free of that. So whenever the person is standing here, this is also like in normal set position. But whenever he is rotating or moving in dynamic orientation, like spatial orientation, at that time this is moving. Like now, if I say moving in the sense what? So if you, how do I put it? So this works basically on the inertia. Okay, inertia. This is the concept of physics. So like you might have experienced in the bus, whenever the bus moves, you tend to go back, right? Whenever bus stops, you tend to go front. So something like this. Whenever a person is like, it is not just the semicircular canal, it is also same with this also, the macule part also. Let's suppose a car is going like this straight, suddenly it is accelerating. Now because of the acceleration, now you remember that Newton's first law. Anything which is moving will continue to move forward, which is anything which is at stationary will be continued to be at the rest until or unless any external force is applied. So similarly, if let's suppose you are in the car and suddenly accelerate. So because all these things were at rest position and there is sudden acceleration, because of the inertia, this will go back. What will go back? The fluid, the endolymph will go back. Now along with the endolymph, this also will go a little back, and this will stimulate. Like we have bilateral, like two ears, no, one is right and the other one is left. So one side will be stimulated, the other side will be negatively stimulated. So one side there will be positive, the other side it will be negatively stimulated. So this is how the brain will interpret these signals. Okay, motion is happening, how, okay, which direction, what's happening. So this is like a genius level. Okay, whoever has made this design. Similarly, here also the same concept applies because of the inertia. Okay, suddenly you are trying to move somewhere. Because of the inertia, the endolymph is moving backward, and that is making the cupula at that direction. So because we have both two ears, that's how our brain interprets from where positive signals are coming, from where negative signals are coming, and how the motion is happening. Okay, so as you understood the physiology of this, I hope I was able to make you understand. So what was happening in the Meniere's disease? There was buildup of the fluid. So because of this excessive fluid, and then there is membrane rupture or whatever, this will disrupt what? This will disrupt this entire dynamics, right? This entire dynamics will be disrupted, and because of this there is vertigo. The person or the brain will receive stimulus in an uncoordinated fashion, and if the brain receives stimulus in an uncoordinated fashion, like not normally, then although you are standing at rest, you will feel the world is rotating, moving, dancing, whatever. Okay, that is about the this thing, like how vertigo happens here because of the Meniere's disease, because of the excess fluid and then rupture and all. So vestibule is what? This is the vestibule. Here we have saccule and utricle. Saccule is for the vertical movement and utricle is for the horizontal movement, because I have told you already here. So this one is the vertical, this one is the utricle is for the horizontal. Okay, so whenever a person is moving straight forward like this will get stimulated. Why? Because this will go back due to inertia. Okay, so there is a sense ki, okay, something is moving forward and all, so that you understood here. So this is because so the vestibule part is for the linear motions. Okay, but the semicircular part, the semicircular canal, this is for the angular rotation or the dynamic balance. So yeah, which department is this? This is the crista department. This is the macula department here. Okay, so if you go in a straight line here above, like in all directions, then this will get activated. If you go in random direction motion, rotational, this and that, something like this, then this will get activated. Okay, So we discussed about how vertigo is happening. So we understood the pathogenesis. So just let's revise once more quickly. What's happening there? Increase in the endolymphatic fluid. Why? Because of the decreased absorption, that is into the endolymphatic sac, or increased production. But most commonly accepted theory is the decreased absorption of if there is an obstruction in the drainage. Because of this, there is distension, which will cause the rupture of the resonance membrane, which will cause the mixing of fluid. So endolymph, which is rich in potassium, will mix with the perilymph, which is rich in sodium. This will cause electrodynamic imbalance. Because of this disturbed vestibular function and disturbed cochlear function, there is vertigo episodes, and there is sensory neural hearing loss, and also the tinnitus. So the SNHL, that is the sensory neuro hearing loss, is fluctuating type, and this is the episodic type. Okay, so we understood the pathogenesis. Then let's talk about something about the etiology, like what is causing it. So first thing, we understood defective absorption by the endolymphatic sac. That was the whole point that I was discussing. And there are some other causes that is mentioned in the book, like vasomotor disturbance, allergy, sodium and water retention, hypothyroidism, autoimmune and viral etiologies. So you can just go through this. Okay, I will anyways give you the notes. So yeah, this was the picture which I had to talk about, but I forgot. Anyways, so this is the normal, no? As you can see everything is normal. Like what is normal? The endolymph, the membranous labyrinth is thin looking, like it is normal. But here, as you can see, it is bulged. See, it is all thick, big, fat. Okay, yeah. Then under the clinical features, we have again same thing: vertigo, hearing loss, and tinnitus. So vertigo, it is mostly sudden and severe, and it is associated with nystagmus, nausea, and vomiting, vagal disturbances, diarrhea, and bradycardia. Then hearing loss. Hearing loss is again, this is fluctuating type, sensory neural hearing loss during vertigo. So whenever there is episodes of vertigo, there is hearing loss. And low frequency is first affected, because this thing, what is apex? See, this part is apex, no? This is my cochlea. This part is the apex. So here, so if you see anatomy wise, when the membrane is turning, so at this point the turning is not sharp enough, but as you go into the apex, the turning is very sharp here. And because of this sharp turn, whenever there is that fluid buildup, no, the first damage happens at the apex. Okay, so the lower frequency, and as we know, the apex here, the apex is responsible to sense the lower frequencies. So lower frequency hearing loss will be there. Okay, so along associated complaints can be like double hearing. Then tinnitus is low pitch roaring kind, like you hear ringing sounds. Next, let's talk about what is Tullio's phenomena. Now, Tullio's phenomena means, as I said, if there is bulging. So here you see what's happening in the Tullio's phenomena. So this is the place where the step is attached, and this is the place where this is the round window, this is the oval window. So if you see closely, here is my saccule, right, and here is my oval window. What is attached here? Here the footplate of the stapes is attached. Now, as I told you, there will be distension. Distension of what? Distension of the membranous labyrinth. So all this saccule, utricle, everything will be distended. Now, if it is distended abnormally, then if there is any kind of loud noise from outside, this will cause increased vibration here, where at the footplate of the stapes, at the oval window. Because of this increased vibration, and because of this distension, so this is adjacent, right? So this vibration will reach directly to the saccule. That is abnormal because of the distension. Normally it should not go there, because this part should go here, no, into the cochlea. The sound wave should go into the cochlea. Why it is going here? There is no role of that. So because of that distension and the loud noise, I'm telling about loud noise, not the normal one. Normal one will not go. But if there is loud noise, so there will be more vibration, and more vibration will reach to the saccule directly. And already the saccule is distended. Because of this, so due to the distended saccule, which is adjacent to the stapes footplate, so loud sound would create loud vibration, and because of that there will be disturbance in the fluid of saccule. So if there is disturbance in the fluid of the saccule, now the saccule is the part of the vestibular system, that is your semicircular canal, macule will be there inside this. So this will cause abnormal discharges, abnormal depolarization, which will create a sense of vertigo, like a sense of motion that will create the vertigo. So brain is sensing abnormal sensation from the saccule. Okay, although it should not sense in normal, in healthy individual. So that will create vertigo. So here loud sound is giving me vertigo. That is nothing but the Tullio's phenomena. Why it is? Because of the higher vibration in the foot plate of the stapes and bulging or distension of the saccule. Okay, so we are done with this also, Tullio's phenomena. Now let's talk about certain variants of the Meniere's disease. So variants under the variants of the Meniere disease, we have the certain variants like cochlear hydrops, the vestibular hydrops, the Tumarkin's crisis, or the Lermois syndrome. So cochlear hydrops means here key feature is what? Hearing symptoms will be affected because it is cochlea. So will there be any vertigo? No. Why? Because vestibular system is not affected, just cochlear system is affected. What about hearing loss? Hearing loss will be there. And some notes like it may evolve into full Meniere. So it is like initial part. I told no, like full, that is not full-fledged. Where is that? So if there is any problem here, how it is causing problem here? So maybe in the initial point, in the initial diseases stage, if there is any rupture here, only this part may be affected. But slowly, if you do not treat and all, if it goes, anyways, it is chronic disease. If it goes like long years, slowly it develops into full-fledged Meniere's disease. Alright, so initially if it is cochlear, then it is cochlear hydrops, there is no vertigo, there is hearing loss. Then what about vestibular hydrops? So there will be only vertigo. Okay, vertigo will be there, but hearing loss will not be there. Balance system is affected here. Okay. So if anything is happening here, it is causing some abnormalities here, but this is not affected. Interesting. But I'm not sure why there is no hearing loss. Okay, anyways, if you know, you can just comment it down. Okay, I will look this later. Then we have the Tumarkin's crisis. So there is sudden drop attack. Sudden drop attack means what? So what happens in this? In this there is sudden violent fall. Okay, so in this there is no vertigo, there is no hearing loss, but the person is suddenly falling down. Now what system is affected here? The vestibular system is affected here. So if there is no loss of consciousness. So if I am telling there is no vertigo, there is no hearing loss, but there is sudden fall, that means it is affecting the vestibular system. Now what is causing it, that the person is suddenly falling down? That means some abnormal discharges going into those sensory organs, and from there it is entering into the brain. That sensory organ is nothing but the otolith organ. Okay, I showed you the otolith organ, no, this one. This is the otolith membrane, the otoconia. So here what is there here? The saccule and utricle. Inside the saccule and utricle, what is there? Macula. So I told you, while you are standing or moving in any single direction, okay, so at that point the macules are getting activated. So if there is some abnormalities here, some otoconial disturbance, whatever, then your brain interprets it you are falling or you are not in right position. So that will cause sudden violent falls. Okay. So Turkmenian crisis, nothing but it is also called a sudden drop attack. So there is no aura, it is just a problem with the vestibular reflex. Okay. Then at last we have the Lermois syndrome. Now what is happening here? See, generally what happens is whenever there is Meniere's disease, it happens something like this. It starts with the vertigo, then sensory neural hearing loss, and then the tinnitus. So it goes something like VST. But in Lermois syndrome, the order reverses. Like first there will be tinnitus, and then there will be sensory neural hearing loss, and then there is vertigo. It goes reversal. So first there will be hearing loss. Here you can add tinnitus, then hearing loss, and then vertigo. So there will be vertigo, yes. There will be hearing loss, yes. So yeah, that's about it. That's about the variants. Like we have the cochlear hydrops, vestibular hydrops, Turkmenian crisis, Tumarkin's crisis, and Lermois syndrome. Alright, and we are left with the clinical examinations, investigations, treatment, and surgeries and all. So this I will take up in another video, okay, where we will be discussing all this in details. Okay, so this will be in another video. So did we understood something from this video? So let's quickly summarize everything. Meniere disease pathogenesis because of the increase in the endolymphatic fluid that will cause the rupture or distension of the regionous membrane. Then there is mixing of the fluid which is causing disturbance in my vestibular function and the cochlear function. In the vestibular function, if it is disturbed, it causes vertigo, which is episodic. If the cochlear function is disturbed, it causes sensory neuron hearing loss and tinnitus. What kind? Fluctuating kind. Aetiology is because of the defective absorption by the endolymphatic sac, vasomotor disturbance, allergies, sodium and water retention, hypothyroidism, autoimmune and viral causes. Under the clinical features, we have the vertigo, which is sudden and severe. We have the nystagmus, nausea and vomiting, and vagal disturbances. Hearing loss, we have fluctuating sensory neural hearing loss, low frequency, apex is affected first, double hearing, tinnitus, low pitch roaring. What is Tullio's phenomena? If there is loud sound, it creates loud vibration, which at the end causes vertigo. Okay. Then variants, we have the cochlear hydrops, vestibular hydrops. Two-Markin's crisis causes sudden drop attacks. Lermois syndrome is the opposite of the VSC, that is the tinnitus, sensory neural hearing loss, and vertigo. And this part I will take in other lecture, okay, because this is already too much. This I thought I will make some 10-12 minutes of video. I don't know how long this will go. And this one you just look it up, okay, even I have to mug up this thing. Thank you.